It's estimated that 1 in 5 Americans will develop skin cancer in their lifetime, making it the most common cancer in the United States. Joining us in what is Skin Cancer Awareness Month, Dr. Andrea Abbott, surgical oncologist at MUSC. Dr. Abbott, thank you so much for joining us today.
Thanks for giving me the platform.
So why is skin cancer so much more common than other cancers?
Well, because skin cancer is not just melanoma. That's the one that everyone's focusing on. But remember, skin cancer also includes squamous cell and basal cell skin cancer.
Okay. And now what separates those two?
Really the aggressiveness and how it appears. So if you start with maybe the most common, that might be basal cell, and then next is squamous cell, and then we get into melanoma.
And now, of course, we know that they say tanning beds and the sun can cause skin cancer. Is this something that can also be hereditary?
Right, so you most commonly would get it from the sun or tanning bed exposure, so UVA and UVB. Very uncommonly, there is some genetic component.
Okay, and now what are some of the early signs and symptoms that we need to look out for?
So this is where I take it back to kindergarten, right? And we'll go through the ABCDs. So A stands for asymmetry. If one half of the lesion looks different than the other, you can't fold it in half. That's abnormal. B stands for border. So if it looks like a starburst pattern or scalloped edges, also not normal. You want to have a nice circular mole. C stands for color. You want the mole to appear to be the same color throughout. So if part of it is light, part of it's dark, maybe red, blue, that's abnormal and should be checked out. And then D is for diameter, and so I brought a visual. So the pencil eraser is 6 millimeters. If you have a mole that's bigger than 6 millimeters, that's something that should be concerning to you. And then of course E is for evolving. So if the mole started out, with all of those like normal features I describe it, then suddenly it's been changing, it's itching, it's bleeding, definitely not okay. And then everything else. So look at your whole body. If one mole looks different than the others, that's something that's not normal.
Okay, so for example, if someone has a mole on their back and they're unsure if it's changing, is there any way to, any type of picture or something we could take to kind of keep track of it over time?
I mean, that's what smartphones are for, right? If you live alone, I think that's hard. Who's looking at your back? So thinking about, take a picture of it somehow in the mirror, ask a friend if you see something. Now that it's summer and kind of that family reunion season, I find that people actually come in because they say, well, I was at, a picnic and somebody pointed out something on my leg that I never noticed before.
Okay, so we know what to look for. How often should we be self-examining?
Every day. Right? I mean, you look at yourself every day in the mirror, but I think what you're really asking me is, the moment you see something, is it like drop everything and go to the doctor? And the answer is probably no, right? Over the course of being outside, getting bug bites, spider bites, working in the yard, you might notice something new on your skin. So take a picture of it, like you said, and then check back a week later, 2 weeks later. Is it showing signs of those A, B, C, D, E's? And if it is, make an appointment.
Should everyone be seeing a dermatologist on a somewhat annual basis?
I think so, especially here in the South. We have a lot of intended and unintended sun exposure. I don't think you need to start at, the age of 8, but once you're in your 20s, I think we're very conscious now about the skin and looking good and making sure that we're doing everything to prevent cancer.
Yeah, and one of those things that we can do to prevent is use sunscreen.
That's right.
So what do I need to look for when I go in the store, and how much do I have to use?
It's overwhelming, right?
Yeah.
Like there are so many ingredients, and so the first thing I would say is, figure out what's your skin type. Are you someone who has very sensitive skin, or you can put anything on your skin and it's okay? So there's 2 types of sunscreen categories. One is a physical blocker. So that means it's not letting sun in. That's the white thick layer, and that's gonna be zinc and titanium. Okay. So when you see those, think about, Baywatch, I guess. And then the second is a chemical blocker, and that's going to be more common in your sprays. And those are gonna be like those really long names like oxybenzone. And those, again, can trigger some allergies if you have sensitive skin. When I look at a sunscreen, I'm looking for 3 main things. Number 1, the SPF. I want it to be at least 30. So throw out those bottles of 8 and 15. They're not good enough for you.
Okay.
Number 2, I wanted to say broad spectrum. So it's blocking both UVA, which is going to cause wrinkles and some sun damage, and UVB, which is also leading towards those skin cancers. And then I also wanted to say water resistant. It's the summer, you're hot, you're sweating, you want something that's going to withstand that.
And now how often should we be reapplying if we're in the sun?
Yeah, every 90 minutes.
Every 90 minutes, whether we're in the water or not?
Correct.
Okay, and how much do we use?
Well, you brought this lovely little glass for me. So that's 1 ounce. You should use 1 ounce per application.
Okay.
So this is a 3-ounce bottle.
Oh.
So if you were to bring you and 2 friends, this bottle would be gone by the time you were home.
Okay, so most of us are probably not using enough.
That's right, yeah.
Oh, wow. Okay, now Dr. Abbott, where can we go for more information?
So I think, number 1, talk to your doctor. If you have some sun sensitivities, you're going to want to figure out the sunscreen that's going to be best for you. I think asking that person for information. The American Academy of Dermatology has excellent information online.
Okay, wonderful. Dr. Abbott, thank you so much for sharing this such important topic with us.
Thanks for having me.
We're back in 2 minutes.